What is the link between epilepsy and depression? Have you ever wondered how epilepsy and depression are connected? It turns out, these two conditions share a complex relationship where each can influence the other. Research shows that people with epilepsy are significantly more likely to experience depression than those without epilepsy. Estimates suggest that between 13% to over 50% of individuals with epilepsy may also face depressive symptoms, depending on the type of epilepsy they have. Interestingly, depression can also increase the risk of developing epilepsy, highlighting a bidirectional link. One key factor in this connection is the shared brain structures involved in both conditions. Areas like the temporal lobe, which includes the hippocampus and amygdala, play crucial roles in regulating emotions and memory. Neuroimaging studies reveal that individuals with epilepsy and depression often show changes in these brain regions, such as hippocampal atrophy and altered connectivity. These changes may contribute to both seizure activity and mood disturbances, suggesting that there are common underlying mechanisms at play. When we look at specific types of epilepsy, temporal lobe epilepsy shows the highest rates of depression. More than half of patients with this type report experiencing depressive symptoms. This is likely due to the involvement of limbic system structures, which are critical for both seizure generation and emotional processing. Other types of epilepsy also show elevated rates of depression, though not as high as temporal lobe epilepsy. The relationship between epilepsy and depression is not just about prevalence, it also affects treatment outcomes. Individuals with both conditions often struggle to achieve seizure freedom and may experience more severe or frequent seizures. This creates a cycle where epilepsy can worsen depressive symptoms, complicating treatment and impacting overall quality of life. Several factors contribute to this link, including genetic predispositions and inflammation. Disruptions in neurotransmitter systems and functional connectivity in brain networks involved in mood and seizure control are also implicated. Emerging research is exploring how gut health and systemic inflammation might serve as shared pathways between epilepsy and depression. Living with epilepsy can bring about stress, stigma, and social challenges, all of which can contribute to feelings of depression. However, it is essential to recognize that depression in epilepsy has distinct biological roots that requiring targeted treatment. Given the high prevalence of depression in individuals with epilepsy, routine screening for depression should be part of epilepsy care. Effectively managing depression can lead to better seizure outcomes and an improved quality of life. Treatment plans should address both neurological and psychiatric aspects, often involving collaboration between neurologists and mental health professionals. Antidepressant therapy may be beneficial and can help prevent structural brain changes associated with untreated depression. It's important to remember that each person's experience with epilepsy and depression is unique. Therefore, personalized care is crucial, taking into account the type of epilepsy, seizure focus, and individual factors. By recognizing and addressing depression in those with epilepsy, we can enhance comprehensive care and improve overall outcomes.